on your acres. Because you can't fake performance, and bushels don't lie. Visit nkseeds.com/harvest.
Your friend in Central Illinois, WHOW.
Top of the morning from the newsroom of Regional Radio. We stream the morning show to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. On the morning show today, we're joined by Kari Knapp, who is a community outreach coordinator with Chestnut Health Systems. Kari, how are you today?
Hi, Seth. I'm doing great. How are you this morning?
Doing well. Thanks for asking, and thanks for making time for us today. We appreciate that very much. And Kari, let's start our conversation. Coming up this Saturday is a big event. I know this is I believe, twice a year event. It's National Drug Takeback Day. Tell us about this a little bit to get us started, Kari.
Sure, I would be more than happy to. So you're exactly right, Seth. This Saturday, October 29th, from 10 a.m. to 2 p.m., is what we consider to be National Prescription Drug Takeback Day. So as you just mentioned, Seth, this initiative is held twice a year, usually during the months of April and October. But overall, it is offered through what we consider to be the DEA, or the Drug Enforcement Administration. So ultimately, this initiative really just encourages the public to remove and properly dispose of any unneeded, old, and or expired medications from their homes, just simply as a measure of preventing medication misuse. All too often, we know that unneeded medication could end up lost or even stolen, but even misused, right? So Drug Takeback Day really serves as a friendly, but also a national reminder for folks in the community to take action to clean out their medicine cabinet safely and anonymously.
When it comes to this, of course, Kari, this is a big effort to not only dispose of those unused and unused drugs, to keep them out of hands of young people, maybe kids, mistakenly giving them to maybe an animal or something of that nature. But also, it's good for the environment. Do you mind speaking to those two aspects of this?
Sure, I would be more than happy to. So again, overall, unused or expired medication can be a public safety issue and ultimately an issue for our environments and our communities, like you said. We want to ensure that those unused medications aren't getting in the hands of someone where maybe they don't need to be, right? So overall, properly disposing of those unneeded drugs can save lives while also protecting the environment and our communities in which we live in. So really taking the proper steps in order to dispose of those drugs is really important. And so again, that is why the Drug Enforcement Agency has set up these Drug Takeback Days. Just again, a national effort for folks to gather all of those unneeded or expired medications and bring them again to those different drop-off location sites within your prospective community. Mm-hmm. But overall, what we do know too is there are a couple different ways of disposing medication, even if it's not through a drug take-back day, if you will. So there is something on the DEA website called dea.gov. And there's actually a search engine on that website where you can go to and you can put in your community information, including your city, your state, your zip code. And then it will bring up all of the different, what we consider to be drug drop-off sites in your location. So even if it's not during one of these drug take-back days, there are places within the communities. Oftentimes those might be pharmacies or local sheriff's departments or police departments where you can go ahead and do drop off those drugs in which you are no longer needing or are expired. So again, like you said, Seth, it's really important to take the proper steps needed, right, to ensure that those drugs are not being misused or mishandled in any way, shape, or form.
No question. And those resources in our communities are good ones. And a lot of them come with kind of no strings attached. It's just, come in, drop off whatever it is you have and be on your way and keep your house and community safe.
Yes, that's exactly the case. And that's just what you said. You want to ensure that this is an opportunity for folks to take those drugs again in a safe and an anonymous way. And so there's really no reporting process on who's dropping off what types of drugs. Ultimately, the folks that are at those drop-off locations. Really just want to ensure that we are keeping folks in the community as healthy as possible.
Sure. Again, our guest on the phone today is Mrs. Kari Knapp. She is a community outreach coordinator with Chestnut Health Systems. Kari, anything else on National Takeback Day that you want to talk about this morning?
Sure, absolutely. So again, folks can go to the DEA.gov/Takeback Day. And again, on that website, you are able to enter in your community information, including zip code, county, city, etc. And you can search within a certain mile radius of your community as to where those participating locations are this Saturday, October 29th from 10 a.m. to 2 p.m. Again, oftentimes local police departments, sheriff's offices are participating sites for these drug take-back days. So again, we encourage you to go to the DEA.gov/Takeback Day to check out which drug take-back day participating locations are within your particular area.
Sure. Kari, let's dive into October. Is a lot of months. We recognize a lot of things in the month of October. Among those is National Youth Substance Use and Prevention Month. Talk a little bit about this, why it's important. How about some of those things this morning, Kari?
Sure, absolutely. So again, October is a very busy month as we recognize substance use as a whole, right? But also how substance use can play a part in the lives of adolescents, right? So we overall know that National Substance Use Prevention Month really is an observance to highlight the important role of substance use prevention within our communities. Simply just remembering that research-driven education, also known as evidence-based education, can truly help keep our youth healthy and safe, but also substance-free. We really want to take the month of October to recognize that this is a time to provide some of that quality education for our students, right? To equip them with the knowledge, the skills that they need to really, again, live healthy and fulfilling lives, but also choose lives that are drug-free. Mm-hmm. We also know that National Substance Use Prevention Month is a time to recognize those who have lost their lives to substance use, but also a time to acknowledge those in recovery, but also the children, the parents, family, and friends who are supporting those folks. So we know that there is various research around prevention efforts, right? But also that evidence-based or that research-driven education. We know that research has proven the harmful effects that substances can have on the human body, but especially amongst adolescents whose bodies are still growing and developing, particularly from a physical, mental, and emotional standpoint. So really looking at that research from, we know that preventing substance use during adolescence can really significantly reduce the chance of developing a substance use disorder later in life. So that is why, again, we're taking this month of October to acknowledge the educators, the teachers in our community, right? Even parents to step up and say, what can I do to start equipping my adolescent, my youth with the skills and knowledge needed to be able to, again, live those healthier lives substance-free. So again, this month can serve as an opportunity to reflect on what prevention efforts are currently taking place in your community, but ultimately what you can do to help with this initiative.
So what are some of those things we can do, Kari?
Sure, absolutely. So taking a look at prevention, right, and thinking through what is the best way of going about doing that. Again, we really want to ensure that the education and resources that we're providing to our adolescents are, again, those research-based, evidence-based resources. So again, taking a look at all the different types of policies and practices that have research backed up by them of saying, okay, we know that these tools work to be able to equip our youth with the skills and knowledge needed to be able to, again, choose substance-free lives. So kind of looking at the best practices of prevention, right, we really know that that starts at an early age, providing adolescents with the skills needed to, again, be able to say no, right, but also, again, the communication skills that are needed, the coping skills that are needed, the decision-making skills that are needed. There's a lot more to that process than simply just saying no to substances. So really just giving, again, those kids the proper education and resources that they need. But also we want to ensure that our prevention efforts are culturally competent, right? And what that simply means is just being aware that there are different types of cultures that are being presented amongst our communities and the various values and beliefs that are associated with that. So really ensuring that our efforts and our education are being tailored to the unique needs of our individuals that we're serving, but also our community. And then at the end of the day, we really want to ensure that we're creating habits that are sustainable. So meaning that they are creating that long-lasting change and equipping those students again with the resources that they need. So as they grow through adolescence and as they continue to develop and change and grow amongst themselves and amongst their relationships, they have those skills needed again to be able to live those healthy lives.
Sure, absolutely. Well, Kari, as it relates to just National Youth Substance Abuse and Prevention Month, one thing that I was talking to a mental health professional here in another county in Piatt County recently, and you brought up a good point earlier. Said that no is not an answer. We need to equip our kids with information on why these things are bad. Just saying no simply doesn't really shed the light on on the negative impacts that doing these things can have on a youth.
Yes, exactly. You definitely nailed it on the head. That's just simply, again, telling students to say no, right? That's a lot more complex than what oftentimes folks seem to think that is, right? So again, students really do need those skills, again, kind of reflecting on the coping, the decision-making skills, the communication skills, again, to build some of those healthier relationships, but also providing them the resources and education as to what substances do to the human body and why they're harmful for our body and why we're encouraging them to say no. And I also want to take a moment to reflect that this week, October 23rd through the 31st, is what we consider to be National Red Ribbon Week. So this is something that folks on this call may have heard of previously. So ultimately, it is one of the largest drug prevention campaigns that happens nationwide. So really, it's just a moment within schools, a week to celebrate, again, living those drug-free lives, but also having conversations with students of how to say no, and again, equipping them with those skills and knowledge needed.
Absolutely. Well, Kari, anything else on that you want to touch on here this morning?
Sure, absolutely. Just again, kind of circling back to prevention, I just want to highlight that there are some different substance use prevention providers within the listening area of this phone call this morning. This is actually a program that is funded through the Illinois Department of Human Services, the Division of Substance Use Prevention and Recovery, also known as SUPER. So kind of thinking through the DeWitt County area, Piatt County Mental Health is the substance use prevention provider for that area. For the McLean County region, we recognize that Project Oz is the substance use prevention program provider. And this is the Logan area. Chestnut Health Systems is actually the prevention provider. So what that simply means is that we have teams of prevention specialists that go out into our middle schools to really, again, equip those students with the evidence-based education that they need and the skills that they need in order to, again, live healthier lives.
Very good. Kari, let's take a time out here. We'll come back with some more. Again, that is Kari Knapp with Chestnut Health Systems. She is the Community Outreach Coordinator, our guest on the phone, and more to come with her here on the WHOW Morning Show.
WHOW.
Let's check the markets now on the RFD Radio Network. I'm Jim Taylor. Corn steady, beans higher, wheat slightly higher at this hour. December corn 6.86 1/4 unchanged. March corn down half a penny, 6.91 3/4. May corn 6.91 1/4, down 3/4. November beans 13.91 1/2, up 9 1/2. January beans up 10 1/4, 14.02 1/2. March beans 14.10 1/2, up 9 1/2. December wheat 8.38, up 3 1/4. March wheat up 2 3/4. 8.57. December bean meal down $5, 410.60. December bean oil 73.23, up 95 cents. In the livestock market, October feeders 176.50, down a dime. October live cattle 150.105, down 62 cents. December lean hogs 88.35, down a dime. In the energy market at this hour, December crude oil futures 86.68, that's up $1.36. Jim Taylor, RFD Radio Network.
Ace is the place with the helpful hardware, folks.
Ace now offers free assembly and free delivery, so it's never been easier to get a great grill for your family, like a Weber gas grill, a Traeger wood pellet grill, or a Big Green Egg charcoal grill. Only at your neighborhood Ace. Around the block. What you need in stock. with people who know their grills.
This is Brad from Gibson Ace Hardware in Clinton, Illinois. Stop in to see us, The Helpful Place, at 114 North Madison Street, Clinton.
See participating store for details.
It's no secret that employers are having a difficult time hiring qualified personnel, whether full or part-time. The Miller Media Group wants to help you, the employer, to find the candidates you're looking for. That's why we've created IllinoisJobPost.com. That's IllinoisJobPost.com. This website is part of a broad radio and internet employment campaign available through the Miller Media Group. Contact your account manager or email sales@randyradio.com for more information. IllinoisJobPost.com is where we put the power of radio and the internet to attract prospective candidates.
Your friend in Central Illinois, WHOW.
Thanks again for being with us this morning. I'm Seth Lawrence with you folks today. The morning show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Again, Kari Knapp with Chestnut Health Systems, the community outreach coordinator, joins us here for this morning. Kari, let's talk a little bit about National Depression and Mental Health Screening Month and some resources for folks out there. How about some of these things?
Sure, absolutely. Thank you so much, Seth. Again, National Depression Screening Month, right, is something that we did want to just highlight briefly this morning. Just simply to take a moment to recognize that mental illness, right, does affect multiple Americans every single year, right? So just like screening for other illnesses such as heart disease or diabetes, depression and mental health screening should be a routine part of healthcare. We recognize too that when these things are identified early on, right, there are proper resources and supports in place to assist with the steps needed to help folks with their recovery journey from mental illness. So something to kind of just take a brief mention on, right, is just like, again, like screening, like other types of screening for other illnesses, we really want to ensure that this is something that folks are aware of, but also understand why you should be screening for depression and mental illness, right? Overall, we know that clinical depression is a serious medical illness, but we also know that sometimes our society kind of makes us feel or makes us think that sometimes depression can just be a normal part of life, right, if you will.
Mm-hmm.
But also, we just want to send a message of hope, right, to individuals who are struggling with depression and mental illness, to say that there is resources out there, there are supports out there, but also we just encourage you to take a moment to talk with your healthcare provider or your doctor to just have these conversations and to start breaking down these pieces as to maybe how you're specifically feeling.
Mm-hmm.
At the end of the day, we ultimately want you to know that you are not alone. We recognize again that there are supports and services out there, and if someone is wanting to get help, that is something that is available within your community.
Very good. So now, where do we find some of those resources, Kari?
Sure, absolutely. So taking again a look at if you are wanting to do an online screening, you can go ahead and go to the Mental Health America website, and that is simply MHAscreening.org. Again, that is the Mental Health America website, which is MHAscreening.org. They offer a screening service on their website, which is anonymous, it's free, it's confidential. But again, that will simply take you through a series of questions, again, to see what best services and supports are in place to help you move forward with the results of that screening.
Mm-hmm.
So again, that is MHAscreening.org. In addition to that, too, I do want to make mention of a national resource called the National Suicide Prevention Lifeline. So this resource is 24/7. It is confidential and it is also free for folks in the area to use. So individuals can simply just call 988 and you will be directly connected with a mental health professional. So this service is made available to anyone in the entire United States that is really needing some additional mental health services and support, but also just to simply assist with maybe any type of mental health crisis that you or a loved one are experiencing.
Very good.
So again, that is the National Suicide Prevention Lifeline, and that is simply just 988.
Awesome. Very good. So yeah, we've heard about and talked about 988 before, and it sounds like a great resource that's continuing to develop as well. So Kari, anything else, by the way, on National Depression Mental Health Screening Month we didn't get to today you want to put out there for
Sure,
us?
absolutely. Again, I just want to take mention to you guys are more than welcome to visit our Chestnut website. That is chestnut.org. But also our Central Illinois phone number is 888-924-3786. Again, anyone that is experiencing any type of mental health crisis or substance use and needs some services and supports, you are more than welcome to reach out to our team of professionals. And if that's something that we can't particularly assist with, we would be more than happy to connect folks in the community with a different provider that can help with those types of services and support.
Very good. Kari, I want to circle back. DEA National Takeback Day and the resources associated with that. Of course, that comes up on Saturday. Highlight those for us one more time, if you would, please.
Yes, I would be more than happy to. So again, this Saturday, October 29th, from 10 a.m. to 2 p.m. is National Prescription Drug Takeback Day. And if you are interested in taking some expired medication, unused medication to a local drop-off site, you can visit the dea.gov/takebackday and enter in your county, your city, your zip code, and search within a certain mile radius to really see which participating locations are within your area. Again, a lot of times those are pharmacies or local police or sheriff's departments, but again, go to dea.gov/takebackday to see which locations are participating sites in your community.
Fantastic. Well, Kari, it's been great to have you on the program today. Thank you so much for this and doing a great job with us. Where do folks go to just learn about Chestnut Health Systems, all the services you provide, the resources you have available? Point us in the direction for those.
Sure, absolutely. I would be happy to. So again, our website is www.chestnut.org. And again, our Central Illinois phone number is 888-924-3786.
Very good. Kari, like I said, good to have you on the program. Great job with us today. And you're welcome back anytime. Join us again, we hope.
Thank you so much, Seth. I appreciate being on here this morning.
That is Kari Knapp. Again, she is the Community Outreach Coordinator with Chestnut Health Systems, our guest on the phone. The morning show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Network news on the way on the WHOW Morning Show.
WHOW.